I'll show you the fastest way to relieve back pain or sciatica if you're over 50, plus what to do to keep it from coming back in the long term. How do you know if it's for you? Well, if you have back pain or sciatica, meaning pain down in your leg, that's worse when you're standing or when you're walking and gets better when sitting, then this will probably be helpful for you. It also may apply if you have pain lying flat on your back, but if you bend your knees or roll over on your side, you feel more comfortable. And the reason for that is when you're standing up or when you're walking, your back is in relative extension, which means backward bending, where you have a little bit more arch in your back here. When you're sitting or when you bend your knees, it opens the spaces up, kind of flattens the lower back out, and takes some pressure off of your joints right here, as well as opens up the spaces where your nerves come out. This applies to people who have degenerative disc disease, meaning the little discs here have gotten smaller, which jams the joints together more. It also narrows these intervertebral foramen, the space where the nerves come out. And so if you see any of those terms on your X-ray or MRI report, this may also apply to you. Now, it's very common knowledge among physical therapists and most other people who know even just a little bit about back pain that forward bending or flexion exercises, meaning you're bending your trunk closer to your hips or your hips closer to your trunk, relieve back pain in these types of circumstances. But what many people, and especially patients, don't recognize is just how much it sometimes takes to open up these spaces between the vertebrae where the nerves come out. And so I want to show you a couple quick tips that will help you to open up those spaces a little bit faster. Then at the end of the video, I'll show you some tips to keep those spaces open. One of the easiest and most convenient ways to relieve back pain during the course of the day is just doing a forward bending stretch from a chair. This puts your back into flexion and opens up the spaces where the nerve roots come out of your neck. Now, there are a few things to keep in mind here. You want to try to go down as far forward as possible to open up the spaces maximally. For some people, it may be inconvenient or painful to reach all the way down to your toes. But you can start out by just putting your elbows on your knees, if that's all you can tolerate, or if you have a little bit of a belly on you, spreading your knees out a little bit to allow your belly to sink in between the legs can also allow you to get a little farther down. You want this to be a supported bend, so try to either support with your hands on your feet or on your ankles so that your back muscles aren't kicking in. And again, the further down you can get, the better off. And many people who have a lot of arch in their lower back, like I do, it takes a lot of bending to actually get those spaces to open up. And many common physical therapy exercises for lower back pain involve lumbar flexion or pulling a knee towards the chest like this. But in many cases, this isn't enough to get the back fully flattened out on the bed. So if you do have a significant curvature in your back, or if you find that you can't relieve your back pain by doing normal forward bending, you may have to really, really pull your knees up as close as possible to your chest until you feel your pelvis kind of tilt up. So you should feel this part of your bottom lift up off the table. That's how you know you're actually getting lumbar flexion in your lower back, rather than just moving the leg, which doesn't accomplish a whole lot. So really trying to pull the knee in close to your chest, or even getting it outside of your body like this, allows you to open up the spaces maximally. Now, another way you can do that, if you're able to do both legs, is to pull up like this, and that allows you to flatten both sides out at the same time while getting the knees outside of your body, which really flattens things. If you can't do that, you can also try doing it from a sitting position, say on a bed or on a couch, where you sit in kind of a butterfly type of stretch, grab onto your ankles or however far you're able to go, and then just pull yourself down into a little bit further forward of a stretch. And then feel the spaces back here kind of open up in your lower back. The further you can sink into that, the better off it'll help, and also the longer it will probably last. Many people think of the spine all as one segment and the muscles that run down on either side of the spine. There's actually little tiny muscles in between each segment. And in order to truly stretch out those muscles, you have to get the back to round out quite a bit. So again, pulling down like that, really opening up those spaces where the nerves come out. Now, if you can't do that, another option is to do it on all fours, like a child's pose or a rocking back on all fours. This is typically the way that it's done like this. But again, you can see there's still some curvature in the lower back here. So if you spread the knees out, again, allow yourself to kind of sink in between the knees and really push yourself back as far as you can with your arms. That'll help maximally open up the spaces. You can also use your abdominal muscles to do a little bit of a pelvic tilt and round out here while pushing yourself back, and that further helps to open up the spaces. Probably the most common lower back pain exercise for people of any age is doing a posterior pelvic tilt or just flattening your back out like this. And I find many patients, when I see them for physical therapy, have usually had physical therapy and have learned this exercise, but they may not fully get things flattened out. So really, really try to tilt as much as you possibly can. Once you tilt as much as you possibly can, even see if you can tilt a little bit more. And really, really hold that contraction, pushing down into the bed. Many patients will do a bridge when I ask them to do a pelvic tilt, and that's a great exercise to do. But you really want to make sure that you get that pelvic tilt all the way in, really flex things down, and then hold that position, then try to go up into your bridge. And if you really get that pelvic tilt deep, you'll find that it's probably very hard to go up significantly high into a bridge. So if you're doing a bridge exercise like this, where you get arch in your lower back, you're probably not really helping yourself out. So really focus on that pelvic tilt exercise first, really flatten it in as much as you can, then go a little bit farther, then try to do the lift. So now what do you do to maintain that relief over the long term? Well, essentially you want to get into more of that pelvic tilt and bridge type of a position during the things which bother you, which for most people over 50 are standing and walking. So trying to do that pelvic tilt exercise, we're going to translate that up into standing now. So again, you want to try to roll under. And if you're starting from a lot of arch in your lower back, this probably isn't enough. You may have to really, really, really roll under. If you have tight or stiff hip flexors, you might have to bend your knees just a little bit to accommodate for that and roll under until you get your lower back flat. It takes some experimenting to do this, and it will probably feel like the first few times that you do it, that you're standing around hunched over like that. In reality, for most people, it doesn't look all that awkward. It's just that it feels that way because if you're used to standing here, then standing like that feels like you're standing like that. So again, really roll under. You'll have to bend the knees, squeeze the glutes, tuck until you find that your spine is in a neutral position. Then from here, try to straighten your knees so you get more to an upright standing position. Now you absolutely cannot hold this all day. So if you're thinking, there's no way I can do that, there's no way I would stand looking like that all day long, you're absolutely right, you can't. Your glutes will tire out, your abdominal muscles will tire out. But if you find that position, go into it, come back up, hold it for a few seconds, then let off to maybe 10%. You're not going to get there overnight, but if you're used to standing in a position like this, if you can form the habit of getting a little bit closer and a little bit closer and a little bit closer, over time, you'll find that it becomes easier for you to do and for you to hold for longer periods of time. Now, what about when you're walking? You can't do this all day long when you're walking. You look like Steve Urkel, if you remember that reference from Family Matters, walking around with your hips underneath of you like that. But walking's a little bit different because when you're walking, you're not staying in one place, you're actually moving your body forwards. And so leaning forwards when you walk is actually a pretty good idea. Many people will lean on a grocery cart or on a walker because they find that helps them out. And the reason is that's opening up the spaces in your lower back. Now, you don't want to walk around like a hunchback like that, but if you lean your trunk just slightly forward when you're walking and push off the back leg, that'll help you keep your spine in a better position. Additionally, keeping your abdominal muscles a little bit tight and pushing off using your glutes will also help you to extend more through your hip rather than extending through your lower back when you go to take a step. So hopefully you found this video helpful. If you did, give it a like and share it with your friends or share it on your Facebook page, because I'm sure you know lots of other people your age who suffer from back pain or sciatica. And if you'd like more tips to relieve sciatica over 50, check out my book, The Over 50 Sciatica Solution. Thanks for watching, and I'll see you in the next video.